Hypertrophic pyloric stenosis are hypertrophy of the circular muscle of pylorus causes the narrowing of pyloric canal between the stomach and the duodenum. So this is the stomach, and this is the second part of duodenum, and this portion is called pylorus, right? Pylorus, the end of stomach, and before start to duodenum. So hypertrophic pyloric stenosis is an abnormal thickening of the pylorus muscle, so through which the food and other stomach content pass into the small intestine. And this condition affects the infant. So the basic pathophysiology, because the thickening of pylorus sphincter causing the obstruction of pyloric canal. This is pyloric canal also called. The pathophysiology, here we see normal anatomy of this portion, but enlarged pylorus and causes the pyloric stenosis. It is called hypertrophy of pylorus, narrowing the canal in between the stomach and duodenum. This is the duodenum, and causes the gastric dilatations. So let me read it. The stenosis usually develops during the first few weeks of life and causes the projectile vomiting. In this picture, projectile vomiting, this is a characteristic feature of hypertrophic pyloric stenosis. So projectile vomiting, palpable olive-shaped mass in the abdomen. Because of this, if you palpate or inspect the baby's abdomen, you can feel olive-shaped mass in the right upper quadrant, and also visible peristalsis web. Peristalsis web, they said. Dehydration common, metabolic alkalosis, and failure to thrive. So what else? What are the data collection? Vomiting that is progresses from mild regurgitations to forceful and projectile that usually occur after a feeding. Vomiters contain gastric content such as milk or formula. It may contain mucus, maybe bloodstream, or does not usually contain the bile. So what else? What are the other data? Hunger or irritabilities, peristalsis web visible from left to right across the epigastrium during or immediate after feeding. So in this picture, this is called olive-shaped mass in right upper quadrant or visible peristalsis web. Olive-shaped mass in epigastric, just right to umbilicus. Dehydration and malnutrition, electrolyte imbalance is common, and also metabolic alkalosis occur. So what are the laboratory tests we can do? Hypokalemia means potassium level go down. And if you check electrolyte, metabolic alkalosis. We diagnose by ultrasound. Intervention, monitor strict intake and output, monitor vomiting episode and stool, obtain daily body weight, monitor for sign of dehydration and electrolyte imbalance, assist to prepare the child and parents for pylorotomy if prescribed. So now surgical treatment. Basically, before to go pylorotomy, IV fluid and electrolyte correction is important. And pylorotomy means enlarge the opening at the pylorus. An incision through the muscle fiber of the pylorus, which may be performed by laparoscopy. Intervention, preoperative. Monitor hydration status by checking the daily weight, input and output, and urine for specific gravity. Correct fluid and electrolyte imbalance. IV fluid may be prescribed for rehydration. Monitor nothing by mouth status. Monitor for number and character of the stool. Maintain the patency of nasogastric tube that is placed for stomach decompression. This is the two picture. This is the normal hypertrophy of pyloric stenosis. So you see the hypertrophy occur. Enlarge the muscular area, nearly obliterate pyloric channel is not normal, narrowing the pathway. And picture B, longitudinal surgical division of muscle draw to submucosa, establish adequate pathway. So it is pyloromyotomy, means muscle cut, opening the channel. Enlarge the opening at the pylorus. Post-operative, monitor intake output, begin small, frequent feeding post-operatively, and gradually increase amount and interval between feeding until a full feeding schedule have been re-instructed. And feed the infant slowly or frequently. Handle the infant minimally after feeding. Monitor for abdominal distension. Monitor the surgical wound for the sign of infections, and also reinforce instruction to the parents about wound care and feeding.